Hey, I'm Kelby Hautauer, Medicare Hub. Are you trying to decide between Medicare Advantage plans and/or Original Medicare? In this video, we're going to break down the key differences, highlight the pros and the cons, and help you make the best choice for your needs. Let's get started. So choosing the right Medicare health plan can feel overwhelming, but understanding the basics is the first step. Let's begin with Original Medicare. Original Medicare consists of Part A, which covers hospital stays, and Part B, which covers medical services like doctor visits, preventative care, and outpatient treatments. This plan offers broad access to providers because you can visit any doctor or any specialist who accepts Medicare without needing referrals or worrying about networks. One of the key benefits of Original Medicare is its flexibility. For example, if you're traveling across the country and need medical care, you're covered as long as the provider accepts Medicare. This nationwide coverage is a major advantage for retirees who like to travel. However, Original Medicare has limitations. It doesn't cover prescription drugs, which requires you to enroll into a separate Part D plan. Additionally, it doesn't include dental, vision, or hearing coverage. Most importantly, there's no cap on out-of-pocket costs, which means your expense can add up quickly without supplemental coverage like Medigap. Now let's look at Medicare Advantage. So Medicare Advantage, also known as Part C, these plans are offered by private insurance companies in bundles, Part A, Part B, and usually Part D into one single plan. They often include extra benefits like dental, hearing, vision, and fitness programs like Silver Sneakers. One of the major issues we see with thousands of clients over the years has been the misunderstanding of what limitations a Medicare Advantage plan can construct around your care or access to care. If explained properly, more than 90% of seniors love their Medicare Advantage plans and they choose them for themselves. Roughly 51% of the nation's seniors choose this as their health plan option. Just ensuring you're dealing with a licensed professional that explains the critical details is very important and answers all the concerns that most Medicare beneficiaries enrolling into these plans have. One of our clients, Sarah, chose a Medicare Advantage plan because it offered coverage for eyeglasses, included a gym membership, which she uses weekly. She also enjoys lower premiums compared to what she would pay with Original Medicare and a Medigap plan. But Medicare Advantage plans isn't without trade-offs. Most plans have network restrictions, meaning you need to use doctors, specialists, and hospitals within that plan's network to get the best coverage. If you go out of network, your costs may be significantly higher. Additionally, some plans require prior authorization for certain services, which can delay care. You know, guys, one of the many questions we get often is the misunderstanding that Medicare Advantage plans, what I call, have guardrails. And if you understand the guardrails properly and you've been educated properly, Medicare Advantage plans can perform and work extremely well. The average cost for most Medicare beneficiaries nationally that are on a Medicare Advantage plan each year is about $750 worth of copay costs. So in other words, they enroll in a plan, the plan covers doctor visits, specialists, preventative services. They can have additional things like dental, hearing, and vision, and it averages them about $750 a year. Now, someone that's moderately sick, it's going to average around $2,850, and then the max out of pocket on these plans typically are going to be less than $6,000 a year. So that's the max risk that you have. But understanding the guardrails that the plans have doctor, specialists, and hospital networks. They also have parameters around to access your care. Now, this is simple, and we're going to talk about it a little bit more in this video today. So a common question we hear is, which plan is better? The answer depends on your need. For example, if you travel frequently or want the freedom to choose any provider, Original Medicare with a Medigap plan may be the best choice for you. On the other hand, if you're looking for a comprehensive benefit at a lower cost, Medicare Advantage plans could be a great fit for you. Let's compare the two options side by side. Original Medicare offers flexibility and nationwide coverage, but it doesn't include extras like dental and vision. Medicare Advantage provides all-in-one coverage with added benefits, but may limit your choice of providers. For instance, Mary, a retiree who splits her time between Florida and New York, chose Original Medicare with a Medigap because it ensures she's covered no matter where she is. Meanwhile, John, who rarely travels and values dental and vision benefits, opted for a Medicare Advantage plan to save on premiums. It's also important to understand how costs work. Original Medicare has a standard deductible and coinsurance for Part A and Part B, while Medicare Advantage plans often have lower premiums but include copays and out-of-pocket maximums. For example, a Medicare Advantage plan might cap your annual expenses at $5,000, providing some financial predictability. So if you're still unsure, Medicare Hub is here to help. Our free Medicare Made Simple webinars and one-on-one consultations provide personalized guidance to help you navigate your options. I want to thank you for watching, guys. Don't forget to like, share, and subscribe to our channel. Watch more videos to learn about Medicare topics and details. Schedule a call today, and let's make Medicare simple for you.